when we think about medical devices include what?
First class 1 devices are considered very low risk, and they would be things like tongue depressors, bandages, the stretcher that you lie on. Stretchers can fall and trap you, tongue depressors can break and you swallow a piece of it,
Right.
but they're so low risk that they're class 1, and you don't require clinical trials to figure
Mhm.
out if they're safe to go on the market. You may want to know that the tongue depressor doesn't have heavy metal in it or things like that. Those things are real, but generally low. Class 2 are intermediate risk devices, and some of them can be implantable. So class 1 by definition is not implantable. But class 2, they used to have a lot of orthopedic implants that were considered class 2. Some of those have been moved to class 3 now, but it would be things like IV pumps that make your intravenous fluid flow in at the correct rate. Again, if it doesn't flow at the correct rate, you could die from an overdose of a drug or not get enough of a drug. And class 3 are the highest risk
Mhm.
devices. Those are devices like deep brain stimulators, pacemakers, defibrillators, implanted defibrillators, those kinds of things.
Would an IUD be in that category?
I think IUDs are in category 2. I think they're class 2.
Interesting. I'm actually even curious about how, once they're in the body, how did they get designated by risk as to 2 or
Yeah,
3? Is that really
yeah,
kind of where they're at in terms of
yeah. I mean,
actual risk?
yeah, it's definitely IUDs can cause a risk. You can have
Right.
perforations, you can get
Sure.
sepsis, but those are relatively low rate occurrences, usually.